Hello everyone, welcome back to Reversing Hashimoto's. I'm your host, Dr. Anshul Gupta, a world's Hashimoto's expert. And I'm really excited today because I have a very special person that has agreed to come over here and give you all hope as well as share her story of how she was able to beat Hashimoto's and reverse it. So I would like to welcome this special person, share her real struggle and story with you all, so you can know that there is hope for you all to get better also. So please, why don't you introduce yourself first?
Hello, my name is Sahel. I am from Australia. I am 48 year old and I'm a mother of two little kids. I was initially diagnosed with Hashimoto's when I was pregnant with my second child. It all started with um, very large hives all over my body, very itchy, very uncomfortable. They were swollen and hot, and that's how I understood something is wrong. It took me years to actually get a diagnosis for this because all my bloods were normal, and while I was pregnant, they couldn't do more. Invasive tests or allergy tests on me. So I was just quietly suffering this and couldn't get anywhere until I finally got a lab to do me a comprehensive blood test, and the test showed that my antibodies were off limits, like above 1,000. My TPO was above 1,000. It was off charts, and that helped the diagnosis of my Hashimoto's. At that time, my thyroid hormones were all looking fine, but I was very miserable. So things, even though my pregnancies were just 2 years apart, I was feeling that I'm a totally different person. I got also gestational diabetes. I was severely fatigued. I couldn't lose the weight after the second pregnancy. I couldn't remember things, like I had gone to a travel. I couldn't remember whether I took the plane to go there or I was going on a train. Like something as vivid as this, I couldn't have any memory of it. Things continued like that, and my life was also different. I was then a mom of two. The fatigue, as I said, was extreme to the extent that I found it very difficult to even do the housework. Through all this time, I was then on thyroxine, levothyroxine, and my blood were looking fine, but like I didn't have anything to go to the doctor to and complain about because the blood were fine. So I was even like distrusting myself, thinking that everything is in my head. Am I depressed? Is there any issue with me? Because it physically looks like that I should be fine. It was just that my lived experience was nothing like that. And I was searching everywhere because I wasn't just convinced that it is that I'm getting old. Yes, I understand that I was getting older, but it was just 2 years different. Like within 2 years, I felt that I am 10 years or more older, as I was noticing the decline in my energy level, in my mood, in my fatigue, constant fatigue. That is why I was searching for something. At that time, I was like, it was last year, 2024, perhaps September or October, that I was very miserable, like very miserable. Like I remember being to doctor twice a week, like this bad. I feel that I was fainting. I was so low in energy. And it was then that I was doing my research, looking around to see if I could like find another way because I wasn't convinced that it is impossible to feel better. I wasn't convinced that just my because my blood tests look normal, I should feel normal too because I wasn't. I was looking for a way and I had two kids. I didn't want to give up. I remember I was at a point that I was feeling that if this continues like this, I am gradually dying, like seriously dying. It was impacting my life. I was thinking of quitting my part-time job because I thought that I cannot continue like that. I was looking online, looking at different things, listening to different podcasts, until I came across like a Facebook, someone writing on the Facebook. I came to your name, Dr. Gupta, and the protocol that you had on this, and a couple of people saying that they had tried it. Someone said that it all made sense, but they hadn't even like talked to you, but read your protocol. So I thought that like even though like the cost of it was not was nothing to me, it was considerable, but I was thinking that I like it is my last chance. I'm dying like this. My husband actually encouraged me because he was seeing how I am slowly declining in energy, declining in mood, and feeling unable to manage our life as I used to. So I started the protocol.
I think because you said that before, you did mention that you went to this endocrine doctor and you talked to him about your antibodies, and just share that story about, like, how he said that nothing could be done about it, and how you felt
Mhm,
defeated, that,
mhm.
like, how is that possible?
Initially, when it was like 2016, when I was sick, first of all, no one was taking me serious that I'm really unwell. Like I have these hives which are very itchy, which are taking all over my body. There must be a reason that this is suddenly coming up. But first of all, just because my blood tests initially were normal, no one was taking me serious initially. Then I took it in my own hands and did a comprehensive blood test overseas, and then brought the result of the blood test because I could see that my TPO is very high. Something must be wrong, and very wrong, because it is really, it's not just slightly over the threshold, it was just considerably higher. So I went to the doctor and said that, look, this is it. And she told me that, look, this is probably the antibody is very high and probably it is Hashimoto's. I said, okay, then what is the cure? What can I do about it? She told me, like, any medication, what do I need to do? Like, I wanted to do something. I was young. It was like 2016, 10 years ago. And the doctor told me that, look, it is Hashimoto's. But first of all, there is no cure for Hashimoto's. Secondly, you don't need to do anything now. Like you aren't at the level that requires any medication or anything. So we wait until your thyroid stops working. And then when the blood tests show, like your thyroid hormones show that they are within the range, within the protocols, that is when we would just start giving you medication to make up for the thyroid work. Like I was shocked that there is no way that um, anything could be done for me at that situation. I still regret it. I feel that perhaps I should have done more. Perhaps I should have looked more to see if there is a way to stop the escalation of this disease. At that time, I had recognized that something is wrong. Perhaps I should have started this, like even a protocol like this one that I did with you, Dr. Gupta. Perhaps if I had done it 10 years ago, the damage was much less. But I was trusting the doctors at the time. I hadn't come across anything like this to doubt what they are saying. So when they told me that, I trusted then. It was just years after years that I could see that I am getting the medication. Like it was 2018, I think I started medication. I was taking the medication, but nothing was changing. Like I myself, like because of reading here and there, I had to some extent lost my trust because I wasn't feeling better. So I was looking myself, like I had realized perhaps like gluten, people say that if you have thyroid issues or autoimmune disease, stay away from gluten. I had reduced this myself, and then with that I had brought like my TPU to 400, 500, 700. It was some improvement already, like not that I had changed in feeling a lot better. I wasn't feeling considerably better, but still I was feeling some success because I had brought my TPO myself lower. Again, I remember that I checked this with the doctor, that these are the things that I hear. Is there any reason that I should reduce gluten or become dairy free? And they said no, there aren't any like research on it. So you don't need to deprive yourself of this. Now I'm glad that I didn't give up just because I was told so, and I kept researching, kept looking, and not give up on my own health.
Absolutely. So, tell us, so you were going through a lot of tiredness, fatigue, that you had to take naps, you had a lot of brain fog issues, your memory was not great, your mood was not good, you're feeling like fainting episodes, and plus, you felt that your gut was not great. So all of these things were happening. You were still taking the medicine. So now tell us where you are now, because you have worked on your health a lot, by doing various things. So if you don't mind sharing, first of all, what you
Mhm.
did during this time that finally worked for you, and then plus,
Mhm.
where you are now
Mhm.
in terms of all of these,
Mhm.
where is your quality of life and stuff.
Yeah. So September 2024 was when I first started this protocol. I liked it that, first of all, the first time that I was talking to you, Dr. Gupta, I was feeling that for the first time someone understands what this disease is about, because you said you told me the things that I was about to say. Like, I felt understood. I felt that the person that I'm trusting is worthy of my trust because they understand me. And that helped me go through the process. The process was not necessarily easiest. It was multifaceted. That was something that I really liked, because it looked like that, yes, I had to work on my meditation, reducing my stress level. I was looking at my diet. I changed my lifestyle to some extent, the way I was eating, the way I was looking at food. And the steps, some of them, they were not necessarily like, I had to put my trust into it. And I did, as I gradually, even with I remember the first week that I was on the medications, I was feeling that my eyes have popped out, as if my eyes were always sunken in, like I was living on the last drops of the energy that I had. I could feel that after a week, like my face is changing. My mom, whom I used to FaceTime all the time, could notice the change even through the FaceTime, through the screens of my mobile phone, was saying that, oh my God, your face is going back to how it used to be like, after the puffiness was going down, the inflammation was going down. And I could feel that gradually I'm gaining the energy back. This time last year, I was feeling that I should actually stop my part-time work because it is becoming impossible. Like, there is no way that I could continue like that, look after my two kids and the household and everything. But in February, on top of everything that I had on, I have started studying a master's degree as well, and I'm doing well. So just managing that extra load, like of work and energy and attention, it just helps me feel a lot better, because I'm feeling that I'm getting myself back. Especially with the memory, I was saying that my brain does not function well. I was considering myself like a clever person, but then I was thinking that I'm losing myself. Like, I couldn't think properly. I couldn't keep a conversation, especially if there were a couple of steps through that. I would leave all important financial conversations to my husband to do, while these were the things that I was on top of in the past. During last year, I could see that I have improved a lot in terms of mood. My sleep has improved, the bloating has gone away. I have actually lost some weight around my waist, which is something that I couldn't see would go anyway. Even if I had lost weight, my bloating and my tummy was still there. My attention and focus, mood, and energy level have all improved. And it's not just my own perception of this. I look at the things that I have achieved during last year, like doing my master's. Half of it is done with good scores, like, shows me that no, things have actually changed. And on top of this, what was the biggest surprise to me and made me really, really excited and puffed was that my recent blood test showed that my TPO has gone so low. It is already at 24. So from above 1,000 to let's say 500 or so, when it was like this time 2024 when I had reduced already gluten and dairy. Now it is at 24. Like if someone who has experienced this disease is listening to me, you would understand how that feels. I was thinking that, yeah, all through that disease, I was thinking that my own body is damaging my body. That is such a difficult thing to deal with. On top of all the physical symptoms, on top of the lack of energy, low mood, and the fact that no one understands you, like on top of all of this, just feeling that I am this, like I am failing myself. It is me who is there is nothing external who is doing that. It is the worst feeling. Like you would only understand it if you have gone through this yourself. But with this also the joy of feeling that I have done it, of course, with with the help of Dr. Gupta, and following through this process, and also the support of my family who were behind my back and supporting me through this. But feeling that yes, I have done it, like I can feel like normal self, my normal self. It's just a feeling that I cannot like it is difficult to explain, but I guess you would get my joy from that.
Absolutely. So again, going back to the antibody numbers, right? So, can you repeat that? So you started off with more than 1,000 of TPO. Then the last time, last year, it was 450s, and they are only 24, which is kind of, coming back to the normal side of things. Is that correct? Can you just repeat again?
Yes, yes. So the first time my TPO was checked, it was above 1,000. How much above the 1,000, we don't even know, because 1,000 was the limit that the lab could measure. So it was just said it is above the 1,000. I have throughout these years, I have had tests showing 700 something, 800s, and my last one last year was 400 something, and that was when I had already reduced dairy and gluten, like I was watching my diet to some extent. And then the recent one, which is in August 2025, has come back to 24, like um, almost normal, I would say.
Yes, that is amazing because, as you quietly pointed out, is that almost nobody believes when I tell people is that there is a possibility of bringing these antibodies down and, sometimes coming back to normal also. Because
Mhm,
most of them, they have been heard by their endocrine doctors or other
mhm, mhm,
specialists that these antibodies never come down. So for you, like, going on a journey from
mhm,
being like, very
mhm,
high of more
mhm,
than
mhm,
1,000 to just 24, that itself, is a big win.
mhm,
Like,
mhm,
most people are not able
mhm,
to achieve it.
mhm,
So
mhm.
giving hope to other people that yes, it is a
Mhm.
possibility to reverse this disease then, right?
One of my challenges is asking my doctors to, because all of the my blood tests are done in Australia and through my like Australian medical system. So every time I have to beg the doctor to do the TPO test for me, because they tell me that, oh, look, you have Hashimoto's, there is no need to do the TPO. Your TPO would be high. There is no need to test it. So every time, like I have to go to the doctor, that please, I'm just making some changes to my diet. Can I monitor how it is going? I understand that it would be high. Like they wouldn't like consider that there is a chance that it would come down. And it was so obvious for them that it would be high and it would be high. We don't need to test it. That it was difficult to just even ask them to include that in my blood test.
And that is across the globe, like, all of my patients, kind of struggle with getting these numbers because they're checked once and then they were often being told, well, like, why are you checking it again? They are going to be high. And then often they are surprised when they actually come lower or come back to normal. They'll say,
Mhm,
oh, maybe it's a lab error, we don't know. But, like,
mhm,
go home, your thyroid numbers are fine in terms of your TSH and things. So that's where they are happy with. they don't even bother that the antibodies are coming down. And getting this test is definitely a huge hassle for almost all patients. And that's what I tell people. Sometimes you have to become your own advocate, towards your own health, because it is your health. You are going to suffer if these antibodies are not coming down. So I'm so glad that you put your foot down and you keep getting these TPO numbers, because first of all, obviously you're feeling good in terms of your symptoms. But second of all, your numbers are changing. That means your thyroid is getting better. So you're finally beating the disease. So that's such a huge thing of reversing or beating a disease, that itself is a huge win for you.
Yeah, exactly. Yeah.
So good. So just tell briefly in terms of people, like, what all things you worked with, in terms of like, you said you made some dietary changes, like work on your stress, plus you took some supplements and they were directed towards like, what, like, any particular themes that, were going through that you liked it or good for you.
Yeah, I liked it that I was doing different things at the same time, like different things in terms of my mental health, reducing the stress, my diet, my lifestyle, but also the supplements were gradual, as if at each stage I was dealing with one problem and then improving that, then moving on to the next stage. So one of the parts was, for example, dealing with the gut, the leaky gut, and improving the microbiome, gut microbiome, and trying to work on healing the gut. And there were parts where the detox was the main part, so liver detox, for example, and also protocols to improve that process. And it was all incorporated with particular diet as well. So watching on things that I'm eating as well. Yeah, gradual, but also in helping thyroid as well, and a couple of others that well, I continued from the beginning to the end, and I'm thinking that I probably continue in the future as well, because I see the positive impact on my health too.
Absolutely. And I think this is a big missing piece in a lot of patients who have tried to work on their own health, is that they will do one thing at a time. Either they are doing a diet to help with their gut, or doing a diet to kind of, support the thyroid, or doing, certain supplements to help with inflammation. But I see that, when people start working on all different aspects of this disease, then things, change a lot. Because people think Hashimoto's or thyroid disorders are just about working on the thyroid, but we know that, it involves so many different, aspects to it. You have to work on your gut, you have to work on inflammation, you have to work on hormones, you have to work on mitochondria, you have to work on detoxification. Obviously, you have to heal the leaky gut, rebalancing, like hormones and things. And then once you start working on all of these things together, in a stepwise manner, that's where things start shifting. So I'm so glad that, you pointed that out for people, is that once you started working on all of these things in a stepwise manner, slowly and slowly your body started shifting. And that's where, things fall in place, and your antibodies came down, and plus, your body started feeling good too.
Yeah, correct. I had previously tried to see if I could, like, looking on the net, reading different things, try to see if I could just buy a supplement myself. I had tried all of this, but I wasn't seeing the result. And to be honest, some of the supplements that I was getting, they were not like, as a person who is not from the field, like medical field, the doses that I was taking were not this strong. So I guess that's what also another thing that I couldn't dare to try like high doses myself without the support of a professional in the field. So that was, I guess, having an impact as well, like a strong doses and bioavailable supplements. So that made a difference.
Yes, no, that is again a very important point. There are so many different supplements, and then again, getting the right dosage, right form, right bioavailability is so important. So, absolutely, you're correct over there. So, thank you for sharing your story. Any parting words you have for people who are listening to you and are dealing with Hashimoto's or thyroid disorders?
Mhm, mhm. I think now that looking back, what I feel is that I feel proud of myself. Proud of myself for not giving up and for just being a critical thinker, to think for myself and to advocate for myself, and to review different things. Look at it's a huge world that we are living in, and there are lots of availabilities, lots of possibilities. Just because one did not help or two did not help or the majority are doing it a different way does not mean that I can give up on something so important like my health. I'm very proud of myself that I did this for me. It is like one of the best things that I have done for myself. So if a patient is listening, I will say do not give up on your health. That's what I would say. Just search and you will find.
Absolutely. And that is such a powerful message, like not giving up. I went to my own health struggles, and everybody who is going out, like, with their own health struggles, whether it's thyroid or Hashimoto's, I always tell them, well, if you're not feeling good, that means you have not find the right, thing that is going to help you out. So keep working, keep looking. Eventually, you are going to get there. But yes, it is very difficult once you're not seeing results in terms of keep going. So it takes a lot of courage, and I'm so glad that you showed the courage, you worked on your health, did the protocol, did all the things which is required for it. Show up every day for doing these things. It's not easy, but then finally, like you're getting your life back. Much more than getting your life back. So I'm so glad for that. So
And I have to thank you again, Dr. Gupta. It's not just a disease, it is like for one person, it is my whole family who is impacted. And now we could, especially my husband, could just take a breath and feel that, yes, we are back to a normal life and have one less thing to stress about. I really appreciate your support through all this. I know it's not easy to do something which is different from what every other doctor is doing. I really appreciate it that someone is dedicating their life to a study, to research, and to see patients like myself.
absolutely. Well, it's always a pleasure seeing, like as you said, not only a person getting better, but everybody around them, because a person is not only a person, he or she touches so many people around us. And that's what we don't realize, that improving our health is not only for us, it is for our kids, it is for our like spouses, it is for our parents, it is for our friends, it is for the community. So one person touches so many different people. And once, like I'm lucky enough to change the trajectory of one person, then so many people are affected. So thank you again, for sharing, again coming over here and sharing the story, because again, it's not normal. Most people will not like to come and be on a camera or like share their story of what they have gone through. It's painful. Nobody wants to remember like those pain things in their life. They want to kind of shut them away.
Move on.
So thank you for coming over here, sharing it. I really appreciate that.
My pleasure. I hope it helps someone.
Absolutely. All right, guys. So you heard it right. Like this is another story that we are sharing today of hope, that yes, don't give up, keep going, and with the right approach, with the right protocols and right things, you can beat this disease and get better. So this is it for today. Thank you so much for coming over here. We'll see you next time. Take care. Bye-bye.
Thank you.